So we're here today to talk about the day that's coming up, the event at Queensgate. Would you like to tell us a little bit more about that?
Absolutely. We are very excited about hosting one of the first that we know of women's wellness events. And what we're trying to do on this day is showcase what our hospital has to offer women throughout their lives, services they might need to access, services they might want to access. But we also want to reach out to voluntary organizations and charity groups to be there as well, so that we can sort of take women on a journey through all of the services they may need or want to access throughout their lives. We want to start with fertility, sexual health, contraception, and then work our way all through a woman's livelihood towards menopause, towards the support later in life.
Okay, so one of the questions I had was, is this the first of these? You have answered this, as far as you know.
Yes.
So how come this hasn't been done before? Because this sounds like something that you would think is a good idea to be done before.
Absolutely. I think no. As far as I know, this is one of the first ever been done in Peterborough. Mm-hmm. There's been a Women's Health Festival in Colchester earlier this year, and there was a Women's Wellness Festival in Wales, in Cardiff, earlier this year. But in Peterborough,
a bit of a journey, yeah.
A bit of a journey. This is the first one ever. And I think, to answer your question why they haven't been done previously, I think women sort of tend to be a little bit forgotten. Women we're mums maybe, we end up a little bit later in life in the workforce, and actually women's health topics are so sensitive that really we don't want to be talking about them openly, although we should. But I think the NHS has realised that actually women should be heard and we should be taken care of, and therefore in the NHS long-term plan 2020, they specifically mention women's health services to be improved, and they specifically mention postnatal care as well for women once they've had children.
Okay, so you're saying, who's there so far? You've mentioned some of the organisations. Who have you got so far?
So from the hospital, who will be there is our gynecology team, and they will be nurses and consultants. Also, our maternity team will be there. Again, they might be obstetricians, but they'll definitely be midwives from all different sectors within midwifery. We also have our breast cancer team, who plays a big part for this day, and also we're using some of their charitable funds to fund this day, which is amazing. We're so grateful to them. We also have teams such as the mental wellness team, who will be coming from the community, but again, an NHS organisation. We have our digital midwifery team, who will be there with lots of new things like electronic notes that women can access, and dad pads that we want to introduce to fathers to be. There will also be the physio pelvic health team. We will be there to talk about all these delicate pelvic health, bladder and bowel issues. We will also have other people like service user representation, such as the Rohan Project, who represents our South Asian population. We will have the Maternity Voices Partnership. So hopefully something for everyone on the day.
And mentioned in some of the literature about the day, you want to address some of the inequalities within care. Do you want to tell me a little bit more about that? What does that mean in effect?
Yeah, I mean, what we realized is women often take a very long time to speak about these problems anyway. So on average, it takes a woman about 6.5 to 7 years to speak up about a bladder problem, which is a long time for somebody to live with a symptom that they're struggling with and potentially affects their quality of life as well as their emotional well-being. But in Peterborough specifically, we know that we have a very diverse community. We have over 140 languages spoken in this region. And we know that a lot of these people don't actually speak English. So for somebody where English is not your first language and you're in a foreign country, it may take a lot longer for you even to know where to go to seek advice or what services are available. And for that reason specifically, we wanted this event to happen within the community, which is why we're having it in Queensgate, something that is free to access for everyone. We're sort of reaching out to show women, we're here to help you. This is what we can help with. These are the services we're offering. And we all care about your health and well-being.
And I guess with what you've just said there, and also to some degree COVID maybe, that you don't want people leaving things too late as well, do you?
Absolutely.
Has that been an issue sometimes that you've seen?
Definitely. Women often say to us in a physio clinic when they come and see us for a pelvic health issue that I just didn't know you were here. I didn't know that this was available to me. If somebody had just told me about this service sooner, I wish somebody had sent me here sooner. So we hope by having this type of event that we can actually show women what they can do to help themselves before they even need to access these services. And if they've already tried some of these things, then we're here to help.
Yes. And there are certain stigmas about certain aspects of women's health as well. The menopause, for example, I mean, that's something I wouldn't know how to talk about that personally.
Absolutely.
Those are the sort of things that you'll be,
Yes.
and are people generally like more comfortable talking about those sort of things
I
now?
think with menopause being quite a hot topic recently in the news, on the TV, I think there's more openness to talk about it now. But some of these symptoms attached to menopause is still very, very private. I mean, intimacy can be an issue in the menopause, just even concentration. We know that it forces women to often leave their jobs due to just brain fog and not being able to have the energy levels that they had before. They lose their confidence. So I think at least with menopause being something that is spoken about now, women are stepping forwards and saying, actually, I do have a problem. Still, I think there is an underrepresentation of the condition within our community. For instance, we know in Cambridge there is a specialist menopause clinic. That's something possibly we can strive towards in our region as well, so that we know we can support women from all ages and from all walks of life. But I think other taboos that you might sort of think about is things like bladder issues, so incontinence, urinary incontinence, fecal incontinence, bowel issues, some things like constipation. Women don't want to be talking to this, not even to their friends. So, and often women can be in a relationship, but their partner doesn't know that they're struggling with these very sensitive issues. So hopefully we can offer them with events like these a safe space where they can come in. They can talk to someone. If you want a bit of privacy, we can take you somewhere to a corner where you can have a private conversation. It means, first of all, you know who we are. You know who you might be seeing when you do come to the hospital, and hopefully you'll know when to come to the hospital.
I was just about to ask about the privacy of it, because that's
absolutely.
I mean, in the middle of Queensgate, there are pluses and minuses of it being held there.
Definitely. But there are areas, because it's in the old next unit.
Yeah.
So we have all the little areas that used to be changing rooms. So there will be little private spaces where if women wanted to have a private conversation, we could arrange that. There's also going to be the Women's Aid, who's a charity for domestic violence. So again, we know that we need to be able to provide that safe space if somebody wants to have a conversation. That is very private to them.
Obviously, we not just Peterborough, but everywhere, is an ageing population. People are living a lot longer now as well. So there may be issues, I'm sure, involved with that as we get older.
Absolutely. Absolutely. And again, the menopause is one of those. We know women live longer. We know women will therefore work longer. So therefore, we need to try to support them and empower their quality of life for longer. We also know that, again, things like bladder issues, things like bowel issues, as we go on later in life, these become more of an issue, and they become an issue that is more difficult to manage. If we can catch them quicker, if they know where to go quicker, they can access our support quicker, we can enable them to help themselves and empower them with the knowledge of what to do with their body and where to go.
You're going to have literature in different languages, information and interpreters as well?
Yes.
Languages?
So, as I mentioned, there's about 140 languages spoken in our region. So there is a big chance that there will be people on the day that might not have English as their first language. And therefore, we have included our interpretation service at the hospital, and they will be there with iPads, and even some of our in-house interpreters might be there present on the day, so that we can help people when English is not their first language. So even then, you are very welcome to attend, and we'll be able to assist.
Okay. And we've spoken about people at the more advanced, more mature age.
Yes.
What about young people as well, young women, late teens, early 20s? I mean, they have their own concerns as well.
Absolutely.
It's a confusing world, isn't it? And
no,
it's a
absolutely.
difficult world, yeah.
And for a woman, gynecological issues is relevant at any age, really. So we want the younger females there as well. Even late teenage to adolescence, so early womanhood, everyone welcome. Because as I mentioned, we will be covering topics such as fertility, contraceptives, sexual health. All of these things are important. And again, we know endometriosis is something that women can suffer from a very young age. And the gynecology team will be there to support on the day with any advice relevant. So everyone welcome.
So you mentioned earlier on some of the organisations, people, etc., who are going to be there.
Yes.
But also you would like others to be involved. Are you looking for anyone specifically? Any other health groups or charities or?
Yes, and I think if we would have wanted the whole of Peterborough there, definitely. I mean, we are a bit limited on space, but if there's anyone who sees this that would want their information to be available on the day so that we can share it with people, please let us know your information. Please share your details. They can go through the hospital communications team and just let us know if there's anything that they want us to share. I think since this is also the first opportunity for us to learn also from other people what services are available and what charity organisations might be available in our region. So again, if there's anyone that sees that is interested, that follows our link on Facebook, absolutely contact us and let us see how we can accommodate either your information or you one person in the day.
I guess I hadn't thought of that. So there might be a new charity or quite a niche group that specifically for a specific community that might be.
Exactly. And if it's new, if it's fresh, or we just didn't know, it wasn't because we didn't want to invite you, but please let us know, share your information so that we can share it with our population.
Like leaflets might be available in that case.
Absolutely.
They can't make it. So is it walk-in, or people can book specific sessions if there's somebody who has a query or a concern?
So walk-ins welcome definitely on the day. They don't need to book a ticket. We do have an Eventbrite link live at the moment, and they can find that on the Peterborough City Facebook page. And if they do want to book there, it's still free, but it means that we can keep a bit of a tally on the numbers for the day. It's just interesting for us to see what the interest is, how many people do think that they would like to come and be there. What we will also have is we'll have live presentations on the day. So not only will there be information stands, there'll be a timetable of live presentations, and we will share this a bit later on. And topics such as the menopause, contraceptives, pelvic health, gut health, all of these will be covered on the day. And again, if women wanted to be there at a specific time for a specific presentation, then they'll know when to come and be there.
So finally, just to wrap it up, what day is it, what times is it, and where is it?
Fantastic. So it's in Queensgate, in the Old Next unit, on the 30th of September. That's a Saturday. And we'll be there from 10 till 5. Everyone is welcome. Bring your husband, bring your partner, bring your children if you have to, but please come and join us to celebrate women's health.
Okay. Thank you very much.
Thank you.